All right, welcome. It is 12:30 and we are going to get started. I want to first say good afternoon. Thank you so much for being here. This is the first webinar of the Bureau of Family Health Developmental Screening Summer Series. So we have three individual webinars that you can register for and attend. We're happy that you're here. We're going to kick it off today with our first webinar with our speaker, Kaylee Hall, who is the Early Childhood Comprehensive Systems Lead with the Bureau of Family Health. Kaylee began her career at the Bureau in 2016 as a practice-based care coordinator and brings a background in provider and family engagement to her systems improvement work. She holds a bachelor's degree in health education from the University of Florida and a Master of Public Health from LSU Health Sciences Center with a concentration in behavioral and community health sciences. We are thrilled that we have Kaylee here today. And I want to remind you guys that we are taking attendance and we will have an evaluation link that I will put in the chat at the end of the presentation. So make sure that you utilize that evaluation. We use that for our continuous improvement, and you will also need that in order to receive continuing education credit for CMEs as well as nursing and social work. So a few other housekeeping things before we turn it over to Kaylee. As a disclosure, Kaylee Hall has disclosed that she has no relevant financial relationships. All remaining faculty, Louisiana AAP Education Committee members, and staff have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. As well as this activity has been planned and implemented in accordance with the accreditation requirements and policies of the Texas Medical Association through this joint providership of Louisiana AAP and the Louisiana Department of Health. The Louisiana AAP is accredited by TMA to provide continuing medical education for physicians. The Louisiana AAP designates this live and enduring activity for a maximum of 0.5 AMA PRA Category 1 credit, and physicians should claim only the credit with the extent of the participation in the activity. If you need additional information on CMEs specifically, you can contact that email on the slide. And again, there is also continuing education credit available for nursing and social work. So remember that you will see the evaluation in the chat in conclusion. And if there's any questions that you have throughout the webinar today with Kaylee, go ahead and drop those in the chat, and we're going to have time to answer those questions at the end. So with that, I'm going to turn it over to Kaylee.
Good afternoon, everyone. Thank you for being here. And Julie, thank you for the introduction. Today, as Julie mentioned, we are talking through opportunity versus crisis and how to explain screening results without creating fear. So our learning objectives today, by the end of this session, the goal is really to be able to describe that impact of provider communication on family understanding of screening results, but also the referral follow-through that we know is so important. We also hope that you all will be able to apply strategies for discussing screening results in a clear, compassionate manner and be able to frame concerns as those opportunities for support and intervention. So we have less than a half hour together today, so we are going to jump right in. So you are not intended to see every detail on this slide, but we did want to show the full documents here. Screening is a routine component of preventive pediatric care that we know supports early identification, timely intervention, and improved outcomes for both children and families. So per Bright Futures American Academy of Pediatrics recommendations, General developmental screenings should be conducted at 9, 18, and 30 months of age, with autism-specific screenings also happening at 18 and 24 months of age. Caregiver perinatal depression screening is also recommended at the 1, 2, 4, and 6-month pediatric visits. And then, of course, additional screening is indicated whenever that caregiver or a clinician has those concerns. You can absolutely go beyond the recommendations. So let's get into the Louisiana developmental screening guidelines. When we're talking about developmental screening, we are talking about the use of those standardized, validated screening tools to, again, identify those children who may be at risk for developmental delays. These screening tools are typically incorporating parent or caregiver reported information and are designed to supplement developmental surveillance conducted during pediatric health supervision visits. Louisiana does have specific state recommendations for developmental screenings, and there's a couple reasons why. The Louisiana Developmental Screening Guidelines were developed in 2015 by a content expert work group convened by the state's Young Child Wellness Collaborative, or YCWC, and were updated again in 2021 and then again in 2023. These state-specific guidelines outline which screenings should be performed, when they should be performed, and which tools should be used. So as you can see on the screen, the dark orange boxes in this periodicity table indicate the American Academy of Pediatrics recommended periodicity, as was seen on the slide prior. And the light orange boxes are supplemental screenings that were added to meet the specific needs of Louisiana's children and families. These include additional screenings for social emotional and barriers to health, which helps provide that well-rounded view of the child and family's current experiences, their strengths, and what their needs may be. In any interaction, especially in the clinic setting, communication matters, but especially in this context, communication matters. Screening is designed to identify areas that may need that further exploration. Screening does not provide a diagnosis, and that distinction really is essential to keep in mind when we are talking with families. Families often won't remember the specific scores or the technical details of a screen, but they are going to remember how that information was communicated to them. Because of that, we know that communication has a real impact on outcome. When done well, communication can increase parent engagement, improve follow-through with referrals and recommendations, and also strengthen the trust in the healthcare team, which we know is so important. You may be thinking about reactions you've observed from families when screening concerns are identified, and we know there can be a range of responses. It's important to note that there are common challenges that we recognize on both sides of these conversations when we are sharing screening results with families. For providers, these conversations can be difficult due to concerns about causing alarm, limited time during visits, uncertainty about next steps and resources that are available to support that family, and then in general, managing those strong emotional responses in real time. On the other end, for families, the experience can bring worry or guilt, confusion about what the results actually mean, fear of labels or diagnoses, and sometimes just feeling overwhelmed by the follow-up recommendation or referral. I have an example I want to insert here. If you think about a family seeking an autism evaluation, this can often include a lengthy wait list for the evaluation itself and potentially another lengthy wait list for the recommended therapies like applied behavioral analysis therapy or ABA. 6 to 12-month wait is typical for both parts of the process, and often each evaluation site can have different intake processes. So maybe one intake site accepts a provider referral for a waitlist placement, but another may require an additional step for a parent calling to complete an intake assessment. Those discrepancies can make navigation even more difficult, and why communication and clear communication is so important. I can recall from my time as a care coordinator in the clinic setting, following up on waitlist placement for a family, the mother was confident that they had been on the waitlist at multiple evaluation sites. But we realized, even though that referral had been sent, when we started calling to give her some support and validation, the intake call was not completed. At the time for this particular site that I'm speaking of, the parent had to call in. No outward calls were being placed by the center, and that parent was not aware of that additional step in the process. So that child was not actually on the wait list at that particular time. This always stands out to me because we worked hard to advocate for a change of that process. But recognizing these parallel challenges helps approach that conversation with more empathy and more intentionality, and reinforces the importance of clear, structured communication. So what can we do? This slide, opportunity-based framework, introduces an opportunity-based approach to sharing screening results with families. So the language we use matters. Saying things like, your child failed the screening, it can feel both definitive and alarming, even though we know that screening is not diagnostic. A more supportive framing may be, this screening suggests that we should take a closer look at how your child is developing. And this shift in language keeps the focus on information gathering and next steps. There are a few core principles behind this approach. We start with strengths when possible, briefly explain what the screening is even measuring, and then normalize that follow-up and further evaluation is a routine part of that care. We then focus on clear next steps and emphasize that early action can be helpful even when there is uncertainty, which we anticipate. A helpful way to summarize this and a way to a caregiver may sound something like this. Screening helps us identify children who may benefit from additional support. This result in this screening doesn't tell us everything, but it gives us useful information about where we should be looking more closely. Overall, the goal is to be clear, be honest, while keeping those families oriented toward understanding and next steps, rather than leaving the clinic visit feeling alarmed. Many of you are likely already doing these things in your daily practice. This slide is intended really just to be a quick refresher and a way to reinforce those habits that are especially helpful during screening conversations. So using plain language, it helps ensure that families understand the message the first time it's shared. Pausing for questions gives families that space to process and engage rather than simply being on the receiving end. Avoiding jargon is important because even common clinical terms can be confusing or carry unintended meanings for families. Checking for understanding helps confirm that what we intended is actually what was heard. And finally, validating emotions without escalating concern helps families feel seen and supported while still keeping the conversation grounded and forward moving. And taken together, all of these bullets seem very simple, but they are small communication practices that do have meaningful impact on how those families understand results and how they may follow through with the next steps. So, when we need to manage uncertainty and really focus on building caregiver confidence, in these moments, it's important for families to hear that uncertainty at this point, when a screening is completed and a risk is identified, is normal. Screening is just the starting point. An additional evaluation is what's going to help provide more clarity over time. We also want to reinforce that early support can be beneficial regardless of where the process ultimately leads, and that families are not expected to navigate these next steps alone. A few simple phrases can help build confidence and reduce that potential anxiety without minimizing concerns. And it may sound like this. Many families have questions at this stage, so normalize their reaction. Let them know that we don't have all the answers today, and that's okay. This simple sentence helps set expectations without shutting down that conversation. Also, the next step is gathering more information. Keep the focus forward and action oriented. And finally, let them know clearly we'll continue to support you through this process. Reinforce that partnership and that continuity of care. Overall, the goal is to acknowledge uncertainty while still helping families feel that support, feel informed, and be able to move forward confidently. So I did want to take a minute to highlight some data from Project SOAR, Screen Often and Accurately Refer, that helped inform some of these tips. For this particular systems level quality improvement initiative, Project SOAR had utilized mixed methods approach for data collection. So they combined quantitative surveys and qualitative interviews to assess the effectiveness of Louisiana's early child developmental health system and identify those barriers to screening and follow-up. For this project, a total of 718 family questionnaires were completed over 2023 to 2024, and then we had an additional 53 providers who participated in a separate survey. Anytime we are talking about data from Project SOAR, it is important to note that the small sample size of the provider survey is a limitation. So the provider insights that we had to go off of represent a focused perspective rather than a comprehensive statewide view of provider experiences. Nonetheless, we gathered a lot of great information. So caregivers reported that they often lacked a clear understanding of what screeners were being conducted, why they were important, and what those results actually meant. One quote that stands out is a caregiver who described themselves as a ping pong in the referral process. While providers who completed this survey frequently discussed health concerns with caregivers, this did not always translate into referrals for specialized care. So we realized in looking through this data that the conversations were happening, but the follow-up was not always there. And we know that screening without effective referrals is not going to ultimately impact health outcomes. So how can we use resource guides with families? Resources to help guide conversations with families when risk is identified includes the Bureau's regional resource guides. Excuse me. These guides were actually created to help providers refer families to relevant services and share those screening related resources. They focus on general and social emotional development, autism, and family wellness. We recommend going through the guides together if there's time with that family to help them begin to explore and evaluate their options. Each regional guide has local contact and referral information for agencies and services, including eligibility criteria, as well as family-oriented resources like milestone tracking apps. These guides are available online at no cost, sponsored by the Bureau, Title V. And when you go on the site, it will look like this, but the map is interactive. So if you have a family in Region 1, you can go ahead and click Region 1, and a PDF guide will pop up that is easy to print and share out. There are additional resources to share with families. These are resources to support your ongoing efforts to provide high quality care for Louisiana's children and families. So the CDC's Learn the Signs, Act Early. This program encourages parents and providers to learn the signs of healthy development, monitor every child's early development, and act early when there is a concern. On this site, you can find free checklists. There are other tools available in their online toolkit. They can be easily distributed and discussed during well child visits to encourage developmental monitoring. The Bureau's medical home coordinator, Julie Emery, who kicked off today's call, also happens to be the state's Learn the Signs Act Early ambassador. So if you need free materials, we know where to go. Also, the CDC's Milestone Moments booklets, if you guys have seen these before, these are booklets that are the perfect size, fit in your purse. They help caregivers track their children's development, support their growth, and make a note of concerns. The booklets include guidance on what to look for at home and what to ask providers about. And if you have a family that's not interested in the tech-savvy apps, this booklet is perfect. Additional resources to share with families include the CDC's Milestone Tracker mobile app. This gives caregivers access and complete developmental milestone checklist. They can watch videos of milestones in action, which is really wonderful because they can see the milestone being performed and find developmentally appropriate activities throughout the app. And then there are the milestone checklists. These can also be downloaded. They are typically one pagers by age and printed with the milestones so that a parent can take one home after a well visit and follow along in between that time before they go back. So when we take a look at statewide resources, Early Steps is, of course, our early intervention program for Louisiana families and children up to 3 years age. And the important thing that we always stress is that anyone can make a referral to Early Steps. Children and their families can be referred by contacting the system point of entry in their region. Once that referral is received, the family will be contacted to set up that eligibility evaluation process. And then if a child doesn't qualify under the developmental delay criteria or with an established medical condition, they may qualify by informed clinical opinion. To receive early intervention services through Early Steps, referral information is reviewed, a developmental screening using the Ages and Stages questionnaire, one of the tools, is completed with the families, and then that family and the intake coordinator make that decision to move forward with the eligibility process. We'll also want to highlight here that all evaluations are conducted in a child's natural environment. So in the home, in a child care center or community, during their naturally occurring routines and activities with families and caregivers. We also want to highlight the Family Resource Center as an additional statewide resource. The Family Resource Center is available to support pediatric providers and families of children with special healthcare needs across the state. The center assists providers in linking families to resources, including support services such as early intervention, child care assistance, insurance, and disability support. It is really easy to contact them. You can call the number on the screen, 504-896-1340. They also accept emails and text. They have bilingual staff available, and they are just a dedicated, incredibly wonderful group of staff who are able to reach out and follow up on that resource linkage. Lots of resources on today's call, and we will be sharing out these slides. So don't feel like you have to jot everything down. But we also would like to highlight the provider to provider consultation line, or PPCL. This is a no-cost provider to provider telephone consultation and education program, and it provides consultation to healthcare providers serving pediatric patients 0 to 21, but also pregnant and postpartum women and their caregivers across the state. This line can help providers address pediatric and perinatal behavioral health issues, substance use disorders, autism spectrum disorders, intellectual and developmental disabilities, interpersonal violence, and more. You can register for the PPCL using the form that's linked on the screen that we will share out, but primary care providers can also call the number 833-721-2881 and receive those real-time supports for managing behavioral health care. I know we covered a lot of resources today. Hopefully, a refresher on some of those tips. Now's the time if you have any questions, and thank you all again for being here today.
Thank you, Kaylee, so much for that great information. I'm going to give you a couple minutes. If there is anything that you want to put in the chat as a question, I did include in the chat, if you did not see that, my email address. So you're welcome to email me if you would like to request any sample or any materials from Learn the Signs Act Early. And I am also going to include in the chat the evaluation that just came through. So you want to make sure to grab that. You'll need that in order to apply for continuing education credits. And then I also want to remind you guys that this is week one, webinar one of a three-part series, not connected. You can take them individually. We have two more coming up the next two Wednesdays, July 22nd and July 29th. Correct? Yes. And so we hope that you register for those as well and join us in those next 2 weeks. As a reminder, the evaluation is in the chat as well as my email address to request any additional information. Again, we want to thank you guys for being here, and thank you, Kaylee, for sharing this information with us. This will also be recorded, or was recorded, and it will be on our website in the coming weeks so that you can share with your colleagues and reference at another time if you would like. Thank you guys, and have a great afternoon.